Just going to do a couple more of those. Breathe in again, please. And out. And now I find that that is not as tender as and tight as it was. I'll just do this one on this side. Oh, that's good. Okay. I believe that he broke the code of the body in that he was able to initiate moves and initiate a system of moves which were negative and positive, which were ever so gentle on the body, that could stimulate a response of the body to heal itself. You see, if you take every other modality out there, apart from the Bowen technique, most modalities impose the will of that modality or the will of the practitioner onto the patient. They have to make it happen. Bowen's philosophy is you don't make it happen. You reset the body to heal itself. So by these small moves, he would generate a response in the body.
With a string instrument, it's attached here and here. And you know, if you've ever played a string instrument, that you have to be in the exact spot and the tension has to be exactly right. That's the same with the Bowen technique. And what I think we're doing is that we're strumming our bodies to reset the autonomic nervous system to heal itself by boom
and out. Okay, and again, and out.
Hamilton, Australia. Oswald Rentsch, Ossie for short, is a farmer turned alternate healthcare practitioner. He has been instrumental in spreading worldwide a manipulative technique said to be a miracle cure for many ills. It was originally devised by Australian therapist Tom Bowen, whom Ossie first met when he was desperately seeking aid for wife Elaine and her crippling neck problem.
Elaine had been in a car accident as a child, fell out of the family car, damaged vertebra in her neck and her back, and her parents were continuously taking her for any sort of health care to keep her mobile and out of pain because of her injuries.
I can still remember that crunch on my head, even, preschool. I got up and chased the car, thinking I'm going to get into terrible trouble for being too close to the door. And so my mother and father didn't even take me to a doctor. They simply, assumed she's alive, she's walking, so she's fine. But it became obvious to them that I was having difficulties. And so they'd travel around to the various practitioners. And then at the tender age of 18, I met this beautiful man, and it was love at first sight. By 18, he'd said to me, would I marry him? At 18, I looked at him and I thought, my heart said, yes, yes, yes. My head said, no. Because I just felt it wasn't fair to him to be encompassed with somebody who was obviously going to be an arthritic or in a lot of disability.
When we eventually married, I was taking her to chiropractors, osteopaths, physiotherapists, anybody that we could go to get relief for her neck. This was very expensive for us because we were not wealthy in any shape or form, and it cost a lot to travel to other places, take a day away from the farm and pay for the treatments that we had. So I set about to study just so that I could help her.
Ossie eventually qualified as a naturopath and osteopath and set up practice, leaving son Graham to run the farm. In 1974, he and Elaine were introduced to Tom Bowen in Adelaide, unaware that the handshake would dramatically change their lives.
We met Mr. Bowen, and the first day we were at Mr. Bowen's office, Oz said, Mr. Bowen, would you have a look at Elaine's body, please? Would you have a look at her neck? He treated me, he put his hands on my neck, and he raised his eyes to the heaven. I saw that look, and I had that feeling of total depression. My heart went to my boots, because I thought, here's another man who has obviously assessed that we have a serious problem here. But he patted me on the side of the cheek, and he said, we'll get this right, but you must never ever have this neck manipulated again. And so he put his hands on me that day, gave me what we call now typically a Bowen treatment. On the way home, even though I'd been in such despair, I could tell the energy was different within my body. And so, you know, he said 6 months and we will have you back to where you should be. But it didn't take 6 months.
Meeting Mr. Bowen was one of the strangest experiences of my life. I didn't know much about him, but a Victorian practitioner who had taken me over introduced me to him at morning tea time, and I said to Mr. Bowen, not knowing why, I'd love to learn from you. And he said, come down and I'll teach you.
Tom Bowen had briefly trained in medicine prior to the Second World War. Somehow, from studying how muscles work, he invented a technique to gently stimulate energy flows, allowing the body to heal itself. With no formal training, he became a practising therapist, attracting an incredible 13,000 patients a year. To hands-on Ossie, it was a mystery, yet a revelation.
I found that he was working on people with very soft moves, mostly on bare skin, sometimes through clothes. The patients were lying on beds, and it just seemed so foreign from all the training that I had. Here we go now. As he was a poor communicator, he didn't tell me what he was doing these first few days. He just said, observe and walk behind me. And that was all he did. So I did that. And after 3 weeks, I said to Elaine, I said, this is crazy. We're not learning anything here. I'm giving this away. So I talked it over with him and he said, just talk to the patients.
Well, I did have a condition that required chemotherapy. And I went on it for a while, but it just made me so sick. I'd lost a lot of weight, depressed. I threw it away in the end, couldn't cope with it. And Walter, my husband, heard about Ossie and got in touch with him, and I just started from there.
The treatment that Eunice was on was not working. And in Eunice's case, the treatment that she got from Ossie was a treatment that worked for her and enabled her to recover. Without that treatment, she wouldn't be here today.
I used to love my tennis. One day, hitting a tennis ball, I did something to the back of my neck. Unfortunately, it never went away, and I ran around the country, everywhere, miles, looking for someone to fix it. And I never found anyone. And then one day someone said Ossie had started up here. And I said I'd go up and see him, and I was talking to a neighbour and they said, but he's a farmer. And I said, well, I'll go up and see. Anyway, I came up, and after many treatments elsewhere, I came for one visit. One visit after years of putting up with that. That's all I needed.
I was talking to Robin. Strange phenomena was that he did not have any notes or charts. He did not have any of his work recorded, written down in any shape or form, and he asked me, would I document it? Would I write it down? Would I draw charts? So I did. As I saw the moves and as we worked on for 2.5 years with him, I would draw and write, and sometimes he'd say, that's not right, and put a line straight through it. Sometimes he'd say, that's right, and then we'd work on how to correct it. I always honour the technique as being one that he devised, but he said we would develop it. He asked us not to teach it until after he passed away.
Over in America, the Bowen technique caught the attention of an experienced and tenacious lady medic.
I used to be a pediatrician, hematologist, oncologist. I did a lot of research work in nutrition, and I also took my psychiatry training. And this technique is by far the most important thing I've ever done. Main thing I had to do was empty my cup of anything I knew about medicine, because it doesn't work in the manner that other things that I'd learned. So I had to empty my cup and learn the technique and become a Bowen practitioner, which I did. If you look at the work we're doing, you'll find out that it's nothing alternative about it. It's affecting the body in a very special manner. Balances the autonomic nervous system and also does something to the blood.
I had to change my ways from being a forceful healthcare practitioner to being a non-invasive, gentle one who allowed the body to do the work. And boy, that was difficult because we always want to get in there and make it happen. You know, I'm the top, I've got to make it happen. And of course, you've got to empty your mental cup and you have to think again when you think about the philosophy of Bowen. And you've also got to consider your ego, because when we're trained, we're told to go out there and do them, go out there and do the adjustment, get it, make it happen. But with Bowen, he said, you don't make anything happen, son. He said, it's all a gift. He said, you just reset the body knows best what's best for it, as long as you pick the right procedure and you do it according to his work, and it must be done pure, then the body will respond if it's able.
I think what we're doing is that we're pulling the skin back and then we're challenging whatever's there and rolling over. And I think we're making a harmonic vibration that goes to the autonomic nervous system to reset it, to heal the body. And I think it probably works the same way that dolphins work. It works through sound, harmonic vibration. And that's the reason I think it's more important than many of the other alternative medicine techniques, because sound goes through everything.
After he did pass away in 1982, there was this tremendous interest by other practitioners in Australia who would come to Hamilton and watch us work. Without notice, they'd just turn up at our door and saying, I want to see this Bowen technique working, and they'd just watch us, and we in our naiveness allowed them to, and they would just watch and go away. And eventually these are the people that said, you've got to get out and teach this before it's lost. If you two people get run over by a bus, as they say, well then it'd be lost for all mankind.
So in 1986, they held their first seminar. Since then, Ossie and Elaine have relentlessly pursued presenting Bowen to the world.
I first met Ossie Rentsch in Australia, in Townsville. I was looking for something else to add on to my reflexology, and then I was told that this man, Ossie Rentsch, was coming to Townsville, and it had to be a wind-up as far as I was concerned. You couldn't have an Australian osteopath adjusting people called Ossie Rentsch. Bowen technique is purely soft tissue. We're working across muscles, tendons, and soft tissues throughout the body. Unlike chiropractic or osteopathy, we tend not to go into the field of diagnosis. Because Bowen is primarily a holistic treatment, we're treating the whole body without referring to named conditions or named diseases.
I was telling you, I couldn't lift it last week and I can this week.
Yeah, well, we'll give it another go now and see how we go. If you just take your shirt off, you don't need to take anything else off, and we'll get you to lie face down on the bed when you're ready. And again. Great. Now, I want to leave you there for a moment or two while your body resets and that relaxes. So, you comfortable like that?
Yeah, I'm right like this.
Look, I'll be back in a moment, okay? Won't be long. And here we go. You still play cricket?
No.
We do 2 or 3 moves, which Bowen so cleverly designed, which will allow the body to take the message of addressing the problem. But we must move away from the body after we do the moves, at least 4 feet, allow the body in its own energy field to respond. If we stay in that energy field and keep on doing things, the body is confused.
Last week I couldn't even lift my arm. I had 1 treatment last week. Sheep hit a gate and took my arm with it, that was all.
Bowen could stop or adjust the vibration according to whatever the body, and this is what we do, according to whatever the body tells us. So we can't really say that we're going to do this and that to a body until we start the work, because it depends entirely on what we find. to you. I want you just to turn your head from side to side and just see whether... yes, you haven't got a great deal of mobility there,
No,
so there's still...
No, too much factor work.
That's right. Time you gave that away. Okay, what we're going to do is just going to release a couple more points here.
Yeah.
That one and this one, and the same one in the back of the neck that we did before. And now I want you to turn your head round to the left now. Does that feel easier?
Yeah, it does, yeah.
Okay, now I want you just to take your arm up. See if we've got any mobility. Want to see?
Yeah, it is a bit better.
Okay.
You're right, it is better.
Okay.
Some of the things that we have reputations for as being very effective and quick are things like frozen shoulders. And I know I'm mentioning conditions, but we still treating the patient. But frozen shoulders, people with asthma, we've been treating those people very effectively, even though we're not treating the asthma, we're treating the person. But those conditions respond very, very well. Frozen shoulders, tennis elbow, which is, both of those are quite difficult to treat with conventional forms of therapy. And we have phenomenal success with those.
Like Ossie and Elaine, Julian holds regular workshops for future therapists. Although some might regard the advice they receive as fanciful, there is little doubt the technique produces results, some now being accredited by science.
In our earlier session about where we're working, we've established exactly the geographical structure and the anatomical structure that we're working on. So now I want to show you a little bit more about the skin slack that we were talking about. So we've got our erector spinae muscles in that location that we know where we are. And you can see here that I'm moving the skin around with my thumbs without sliding. Can you all see that? I roll my thumbs downwards, I challenge the muscle, and I just lift my wrists and roll over. And the muscle rolls as I make the move. My thumbs aren't moving, my wrists and my hands are moving. I do the opposite side with my index fingers. So the same process is there. Skin slack being taken away and gripping hold of the muscle, and now I just drop my wrists and flatten my fingers. Bowen worked on a series of using stoppers in the lower back and the upper back to temporarily confine energy to certain parts of the body. Now that's temporarily, i.e. for a period of minutes rather than a period of hours, or until the patient stands up. So Bowen then cut the body into three, if you like, and generated energy within those areas. And what we're going to do is move across the tendon in the same way that we did across everything else. We're taking the skin slack and we're moving across the tendon medially, and we're generating a degree of energy up into that lower half of the body. It seems in some way that the Bowen treatment will concentrate the energy in a part of the body for a period of time and then release it throughout the whole body. So there's like a vibrational energy going through the whole body. Many people report heating up. They're feeling very hot, or they're feeling that something is happening in their lower back. Even people that are not necessarily understanding or even very skeptical of the word will say, well, it feels like your hands are still there.
Hello, Ossie.
Hello, David. How are you?
Oh, not bad, mate. How are you?
Good to
a long
see you.
time since I've seen you.
So travelling around with Ossie is it's an experience, because he sees somebody that's got an injury or something wrong with them, and he's in there straight away. And we walk into a restaurant, and as we do quite a lot when he's over here, we travel around and we have to eat out, and he'll see somebody who's got a bandage, and it'll be, oh, g'day, what's the problem with your wrist? And I sprained it or whatever. Oh, right. Would you mind if I have a look at it? Perhaps I could help you, kind of thing. And suddenly he's in there, and history's going on, and we're having a drink with them, and it's just a nightmare.
That now.
Oh, that's a lot better.
Yeah,
It's
good on
lovely.
you. Mind if I sit down for a minute?
No, help yourself. That's just what you need for doing your farm, Oz.
Yeah, I need it all right, but there's a little bit of thing called cost that comes into it. Are they any good?
We can work something out with that, yes.
Yeah.
Oh, yeah, they're ideal for towing little trailers around or putting a spray unit on, something like that,
Yeah. What about in the mud?
Oh, real good.
Yeah.
Real good. They'll go where you can't walk.
Our daughter, Elaine, decided to study medicine. That was her choice. We hadn't encouraged her or any of our children to take any special interest in any occupation, but she chose to do this. And she's always had a great knowledge of Bowen, growing up in the family. And even in her medical days at medical school, she was helping fellow medical students. Although they scoffed at the idea that perhaps her father was a natural therapist, an alternative therapist, they still chose to allow her to resolve their problems. She did call me up one day when we were in Queensland and said, "Dad, can you help me?" I said, "What's the problem?" This was when she was an intern, and she said, "What do you do when you have a person with a neck and they're standing up and you need to do this move and that move?" And I said, "Well, have you done that?" And she said, "Yes." And I said, "Well, then you need to do this move and that move on the neck, and you can do that while you're standing up." And she said, "Yes, okay, I can do that." And then I thought this was a little strange, and I said, "By the way, who are you treating?" And she said, "Oh, my registrar." So they're quite happy to have treatment when it suits them.
Most of my friends, medical physicians, do not understand the Bowen technique and how it works. We must get this statistical evidence and good information to be able to present it to the world.
At the end of the day, research is one of these things that you can prove something until you're blue in the face on paper, but it's not until you actually get the results and you see that it really works. And effectively, okay, we can prove it to a group of scientists, but it's the person in the street whose shoulder suddenly moves. That's where the research really counts, I think.
Bowen has given me my physical life. He has given me my physical being back. And when I play golf now, I feel just so exhilarated. It is just the most wonderful feeling to be out there, to be able to use my arms and my body without restriction, without pain, and to enjoy the passion of my life, which is my golf.
Yes, 12 o'clock.
12 it is, that's right. Okay, well, if you'd just like to take a chair in the waiting room, we'll be with you in a moment.
Thank you.
I decided, obviously, that I needed to be by my husband's side. I mean, I literally have not left his side from when we first met. He needed company, he needed companionship, but he needed also somebody who could help him or assist him with his teaching. We have taught many people. When we look at the statistics, I think probably it's very close on 7,000 people now who have been introduced to the technique. I would love to think that Mr. Bowen's work would be etched into the history books of the greatest healing modality of all mankind. That when Oz and I are dead and gone and generation after generation, that it will still be there as something very, very special.
It could revolutionise modern healthcare as we know it because it's quick. It's very quick. This is the thing, is that we're not talking about long drawn-out procedures. We're not talking about lots of surgery. We're talking about a very simple procedure that can be done in a GP surgery without even extending the time for a straightforward consultation.
My real goal in working with the Bowen technique is to have a new type of primary health care healer. I'm sure that I can teach housewives to be Bowen practitioners. And the reason this is important is all you need is your hands. And you don't need a lot of medical knowledge to do this. And we could set this up all over the world in the bush, which is being used in Australia, but it could be used in any country. It would be cheap, it's effective, and not only that, it doesn't hurt you.
I believe it's got one of the most exciting futures, and our goal is to get it out to people, to as many as we can, then bring in the research to prove what it will do. We don't need to do that because the simple truth of it is it works.